We're gonna have a fun week this week looking at how the foot affects the hip and how the hip affects the foot. So we're gonna run through a quick test today. Oftentimes when you have knee pain, the issue is coming from the hip or from the foot, and they're creating a twist at the knee. And so this is what can cause irritation in your knee. So we wanna look at how much range of motion you have in your lower legs, and then how that range of motion might be affecting or affected by what's happening at your hip. So I want you to have a seat for me, look straight down at your legs, and then I want you to take your toes and turn them in. And then what you're gonna look at is how much one side turns in relative to the other. So let's say my foot looks like this. So I'm getting this one in a little bit and this one in a lot. So that would be a loss of internal tibial rotation on this left leg. Or if it was on the right, it would be this way, where it's a little bit of a loss on the right. Now, what is that telling me about what's happening to the hip? So oftentimes if the deep hip rotators are weak, then the foot lower leg complex will try to compensate. So it will turn out to assist those deep hip rotators in turning out. And the other thing it'll do is help to kind of compensate for tightness. So if the hip is tight, then that's going to affect the foot and lower leg positioning as well. And oftentimes tightness and weakness go hand in hand together. Now, what we're going to be looking at this week after you do your test is kind of how to break that down, and a great exercise to help you work through reestablishing that internal rotation. But instead of just establishing the internal rotation, which is great, that's one step, but it's just going to go right back if you don't fix the issue with the hip. So we're going to be looking at an exercise that promotes that internal rotation range while strengthening the hip. So that's going to be lots of fun. So stick with us this week for our fun hip, foot, lower leg exploration.